When it comes to a community, the first thing I think of is using the drugs. It's easy for someone to use drugs like it is nothing, but they actually do they know what the kind of advantage it can come along with it? Typically, the term drug, when used by pharmacists, is referring to a pharmaceutical. Some examples of pharmaceuticals would be antibiotics, pills, and SSRIs. One category would be considered as illicit drugs, which are used to generally get a user a quick, intensely pleasant experience. Some examples of illicit drugs are heroin, nicotine, cocaine, and PCP. Other illicit drugs that are lower and not highly addictive or physically harmful to the users, which would be marijuana, commonly used drug by far, as well as LSD. The majority of people have a harder time trying to find LSD, typically because it's not a commonly used drug. Now that you guys know what the meaning of drugs are, it is known that drugs are practically human alternating substances that can be provided in our society to have an outrageous impact on the use communities. Drugs, however, are responsible for the majority of the human innovation of health, philosophy, and other areas of studies which help destroy the negative connections to the actual word drugs. It is hard to say whether or not drugs can actually be good or bad, but it is certainly clear that drugs do have an impact towards the human history of a user abusing what is given to them in their communities. If a household has parents abusing drugs in front of their children, then how is this teaching the child that it is not the right thing to do? As a child gets older, it will only be nature to their minds that they would want to abuse the habits that their parents have unless there is local help to get them out of their situation that they are in. This leads to looking forward towards schools to help these children obtain the information about specific types of drugs that I have mentioned. What is outrageous is that children seem to have an easy access from their parents' liquor cabinets. These children aren't left unattained and can have a problem with alcohol before they even know it. There are always ways to provide help communities by staying involved with the right people or even activities so that children do not get caught up looking for an excuse to kill time from boredom or even to be cool. I understand that it's hard for those parents growing up as a single child and my mom constantly working day in and day out trying to provide for myself. This only makes it harder and leads kids unsupervised and out in the streets looking for something to do. Most of these kids get caught up looking for drinking with friends or even getting caught up in bad situations and smoking marijuana. A lot of these things are also shown on television or also in songs, and they believe that they want the chill effect that it gives them when attaining through all the drugs that they are taking. Another excessive drug that children seem to get fixed after they abuse for a lesser of illicit drug like marijuana is cocaine. The illicit drug has more effects that contain a child to lose control of. These drugs can affect our bodies and is deadly, and no one really knows what these drugs can do when enhancing them in an abusive way. When looking at my community for drugs use problems, and it only begins with the parents. The young ones are growing up around, and if the adults aren't doing the things that they should not be doing, then it should not be around the kids. It should be done in a private area that kids cannot learn the use of drugs are being taken and how they are being taken. In the book, How Successes and Failures in School Related to Adolescent Smoking, Drinking, Drug Use, and Delinquencies by Gerald G. Beckman, states that parental involvement in early years was more important than later parental involvement in the later years. This being said, that adults need to act like parents and that they should not be doing things that they shouldn't be doing and have an influence towards their kids in a positive manner, not a negative path that leads them into not successful. According to the book Ethology and Prevention of Drug Abuse Among Minority Youth by Gilbert Boltovin, he states that due to the low level of parental support and weak parental sanctions against using alcohol can be related to adolescent drug use. Parents should practice communication, strong consistent messages about the abstinent from drug use from their children. This clearly states that the parents should be doing their job of taking care of their child so that they prevent their child from getting hooked into bad habits. The more that a child is informed with these likelihood of obtaining a drug, is clearly that they would stay away from it. Another thing that is stated from Barry Stimwell in a book called Alcoholism, Drug Addiction, and the Road to Recovery, Life on the Edge, that most children's, quote unquote, that most children's before they are in junior high, that they should know the dangers of each drug, but also a relatively few side effects that some mood alternating drugs may produce so that others do not overdose on, like the majority of the kids do nowadays. People understand that parents are busy at work and understand that situations having to provide for their families. There are other resources out there parents can resort to when needing help for their child off the drugs. There's churches and also daycares, friends, relatives, neighbors to look forward to help out and make sure that your child is seeking help. It is even stated by Bowden, a parent can look aside into their community and find the people like community leaders, school staff, and human service workers to contribute towards kids by sessions of workbooks or video instructions that are created to share parent-youth activities about the drugs. How is it that communities say they have a parent's back when helping out on the children to help educate them on alcohol as well as illicit drugs? It clearly shows that the majority of these abusers are coming from younger established generations. The main question is, are the communities actually helping out, or are they just all talk? In a book by Gerald G. Backman, he states that numerous analysts of MTF data and other research have shown that students/children who frequently attend religious services or rate religion to be important in their lives are less likely to use cigarettes, alcohol, or even to abuse illicit drugs. This shows that churches are actually trying to help out from the statement it states, and frequently in order to receive the educational help from helping them abuse the drugs, they also need money to help provide for these communities to give back so that they can watch these kids and show them, as well as schools do, to educate them on the illicit drugs. When it comes to the schools, they can only do so much. They are providing for counselors to educate their children about drug abuse and alcoholism. They even provide the police department to come out to make sure certain situations on educating the efforts on obtaining the use of drugs. However, sometimes I feel like this does not help due to the fact that it can already be too late when the children is already involved as a drug or is obtaining alcohol at a high level. This is sad to see that in the youth in our community at such a young age for abusing drugs. Looking at these statistics is stated by Stimwell, at least 6 to 10% of 12 to 16-year-olds are felt to be current users of illicit drugs. It is estimated that approximately 49% of 12-year-old grade students had used the drug marijuana in their lifetime. This is mind-blowing to me, and that it should be controlled and immediately looked at. There are thousands of problems surrounding drug use in the United States. However, the most important one that comes across the youth happens to be alcohol, not marijuana or cocaine. The first key problem that I feel like that is our problem is that the age for drinking is 21, and majority of these kids are already having a drink by the age of 12. The first key problem that we'll be mentioning, the easiest one to attain, which happens to be alcohol. When stated by Beckham, as early as 8th grade students that are reported any drinking within 30 days are reported to have drank more than 5 drinks in a row. Is that serious? At least once during the past 2 weeks as well. He also states that most troubling is finding out most of these young drinkers use large quantities of alcohol at least some time. The thing that is amazing in these facts that younger kids are attaining large amounts of alcohol when they are still growing up and having their brain cells become as an adult is restated from Botevan, specifically focused on alcohol consumptions because alcohol was most prevalently used drug. Thing about how bad alcohol really is mind-blowing. People see it as a way to social, but eventually when socializing it can lead to death if not careful. Stemmel states in an article that alcohol estimates related deaths range from 50,000 to 200,000 per year. Many of these deaths are unrelated to the chronic medical consumptions of alcohol. Imagining the numerous amounts of families that are losing a family member each day to alcohol, and it is outrageous to think that this alcohol that we like to use to socialize is causing a death and hurting our families. Another unique statistic that Stemmel states in his article is that alcohol is a way to experiment with occasional social use to continue a subsequent drug like marijuana. This is why majority of abusers of illicit drugs start off on alcohol and then only work their way up to a higher drug because they are getting bored of the one that they are taking. This leads me to marijuana, and marijuana happens to be the most talked about drug by televisions or even mentioned in songs, like I said in the beginning. It is stated by Beckman, marijuana has been the most widely used illicit drug in recent decades and only begins at earlier ages than most other illicit drugs. Beckman also states that 60% of high school seniors had used marijuana sometime throughout their lifetime, and about 37% are still present users. The main reason that many of these people have referred to marijuana is due to the fact that California, or even as well as Colorado, have allowed these illegal drugs to come in and be non-illegal. Barry Stemmel claims that in his article that in 1996, when California approved the a Consummate Use Act allowing residents of state to possess and cultivate marijuana for medical purposes, that the higher rise of marijuana use is only increasing and will eventually be taxed, I feel like. It is clearly showing that the United States have moved on with marijuana being used and carried, which is why the percent of people are abusing the drug at such an early age. Marijuana is no joke, and it has gotten so real for kids to get a hold of that Gilbert Boltovin states, for marijuana, lifetime has nearly tripled since 1992 among 8th graders, has nearly doubled for 10th graders, and only has increased 50% for the 12th graders, leaving a concerning cause of drug use and the knowledge of methods to try to prevent the obtaining the drug. These numbers are ridiculous in my mind and should not only be allowed for such kids at a young age, but that they're developing and trying to educate themselves for a college level, and they should not even have a hold of these drugs. In the book, The Ethology of Prevention of Drug Abuse Among Minor Youth by Gilbert Boltovin provides information on how marijuana use among our society has tripled since the 1990s. The main reason that there is a rise, according to Schenck, is that there is not ways to provide for these kids to tell them how this drug can actually impact them. The use of drugs amongst the inner city child have no timetable for drug addiction to come to a halt. This is the reason Schenck is behind writing a book saying that these kids need a role model to help them prevail from these drugs or even alcohol abuse at such a young age. In the book, How Successes and Failure in School Relate to Adolescent Smoking, Drinking, Drug Use, and Delinquency by Gerald Beckman, makes a great example for families out there to find out if their kids are safe from schools with drugs. Beckman illustrates how a school actually does its job on protecting a teen from drugs or gets them closer. It also will discuss the health of education on drugs use connections. All the authors that were provided in this book have actual connection of drug use and will tell stories that they have gone through. When a real community is out keeping an eye for your youth and making sure that they are given every opportunity to succeed in the correct path, that means through the hell with the children and working your butt off as a parent. My research paper provides a problem with drugs in the United States among our communities, suggesting ways like educational help for our youth can help keep drugs away. Having the school help out a parent with illicit drugs and knowing what they actually can cause the child is always a positive in my mind. The parents are also, in fact, the biggest example for a child to grow up with, to see it idle and not abuse drugs such as alcohol. For other illicit drugs like marijuana and cocaine are just lead ups, the parent cannot do anything but prevent them and watch them so that they do not get their hands on it or even hang out with the wrong people influence. These illicit drugs are dangerous, and this is why I have chosen drugs as a main topic for affecting communities. The use of drugs needs to be slowed down and narrowed down to keep out of children's reach before drugs carry out our nation of destruction.